Ben?
Do tell, do tell.
Well, I mean, I think it's because, um, the world has been more focused on New York this week,
Uh-huh.
and like the world, I at least have been more focused on New York as well. And so, in this episode coming up, after
Hmm.
we talk a little bit about the news, we're gonna have an interview that I did with the wonderful women of the Campaign for New York Health, who are trying to pass single payer health care
Awesome.
in New York.
Yes.
And
Fantastic.
we also, we talked about some other New York stuff.
What would that be?
Ben, I know that you're a Celtics fan, but as
Hmm.
everyone else in the world has come to know and love, the Knicks are about to win it.
Well, love you, campaign for New York Health, but fuck the Knicks. I just got to get this in there before the Knicks love fest happens when the ensuing interview. So
Very good, very good. All right,
I
so
hope they
you're
choke as badly as the Spurs did in Game 4.
whoa. Um, yeah, okay. You can hope all you want. I mean, that's the great thing about New York. It doesn't care what you hope, you know?
This is true. This is
Yeah.
true.
Look at the Yankees, 27 rings. Um,
Guess what doesn't care what you want? The Trump administration.
oh man, do you want to talk about the Trump administration? Because I
not,
have some
not
things we
really. Can we
can.
skip it for once? Is there more erectile dysfunction news we could focus on this week?
Oh my God, Ben, you don't even know. I like wake up every morning now and Google search the news for erectile dysfunction. I'm like, God,
Mhm.
I really hope we can talk about erectile dysfunction this week instead of new Medicaid work requirements.
Maybe we could just follow that one guy who we were talking about, the spokesperson, and just track everything he says each week, and then we'll never be short on ED discussions to be had.
Yeah, absolutely.
Hmm.
For those who are not, who are not regular listeners, and honestly, why aren't you? You should be listening. Make sure to like and subscribe to the Medicare for All podcast. Share our episodes. But for those of you who weren't listening, the hantavirus spokesperson, the point person who's handling the hantavirus outbreak for the CDC now is an erectile dysfunction doctor. How do we
Hmm.
end up talking about this again? Man, Ben, you can't stop talking about erectile dysfunction.
Me?
You've
Are
just
you
got
sure it's
dick on the
me?
brain.
Yes. Who
all
wakes up
right,
every
all
morning?
right,
All right, moving
all right.
on.
No, I've got serious shit to talk about now.
Okay, all right, fine.
Oh, honey, serious shit. I am not looking forward to talking about. So, the big thing in the news this week is, of course, the new Medicaid work requirements, which just dropped this week. So, folks might remember, right, that that last year Congress basically passed a law that would allow for Medicaid work requirements, and what dropped now is the rule, right? So the difference between the law and the rule is basically, I don't know, Ben, do you want to explain it?
Well, the rules, these are like regulations that implement the law. And
Mm-hmm.
my understanding, usually this is quite a long process because they make a draft rule, they post it, then there's a public comment period, and everyone weighs in, and they're like mandated to reply to all of the comments that were submitted. But that
Mm-hmm.
did not happen in this case. Best I understand, they skipped the entire public comments and
No,
notice period.
sir.
So,
We are actually currently in the public comment
oh,
period.
right. So well, that's effectively getting rid of it, right? I mean, when you do it after you publish the rule, then it's a
Yeah.
complaining session, right?
That's interesting. That's an
Mhm.
interesting philosophy about this. Yeah. So, like Ben said, right, like the rule basically sets out the parameters by which they can execute the law. So, like for this one, we're talking about work requirements. It decides who's required to actually try to find a job, who is eligible for an exemption, et cetera, et cetera. So they further defined things that had been undefined previously. Um,
Mhm.
And we are in the public comment period. And I will make sure to drop in the links in this episode, a link where you can go and actually make your own public comment. But I know all this, Ben, because I pay attention to what Chuck Grassley is saying.
Oh, well, I fear for your sanity, but what did he have to say?
Chuck Grassley did a speech on the House, and he's been he really loves work requirements. He's loved them forever. Actually, he makes it pretty clear in this speech. But for those who don't know Chuck, he is an Iowa senator. He's been a senator since 1981. So the man doesn't really know a lot about job loss. He's still alive,
still among the living.
yes, and that's basically all he's got going for him. So basically what he did was he gave this speech about the work requirements, about how awesome they were on the floor, announcing the rule, etc., and announcing the public comment period. It was it was a nostalgic time for him because it reminded him of the 90s. And me, I love to reminisce about the 90s, but
sure.
He is not talking about TLC. So basically, he's like, this is awesome because it's a real throwback to 1990s welfare reform.
Okay.
You remember 1990s welfare reform, Ben, right?
Who doesn't? I mean, this was this was basically the destruction of welfare. Yes, I mean, the utter dismantling of welfare and the rapid. It was just like pulling the safety net out from under low-income people.
Yeah, absolutely. And one of the big parts of that, then the 1996 law that ended up passing was work requirements for welfare. And so, when Chuck sees an idea he likes, he goes with it, for
was this the
40
Clinton
to 50 years.
reform? Am I remembering this correctly?
Yeah, that's correct. It was Jesus. A Clinton reform. It was, although of course it was famously bipartisan, because that's when they were willing to work across the aisle to really screw Black people and poor people.
Nothing brings together bipartisanship.
Let me give you a few of the highlights from Chuck's speech. All right. Okay. So he does this whole throwback thing. He's talking about the mid to late 90s and Clinton and the Republican Congress, and they worked hard to do a bipartisan reform package. And then he says, talks about the work requirements. He says, it was a great success. It reduced the welfare population by about 40%, which is funny. Like, I love it when they brag and they're like, yeah, we tightened the restrictions. So now 40% fewer people are on welfare. It's
you may not know this, but if people in poverty aren't receiving support, they don't exist anymore in poverty.
Amazing.
They just disappear.
Amazing. Just completely. So, I mean, and that made Chuck happy. And he said that it's really, it's not just good for, the country. It's been good for them too, for people. He said a lot of people were saying having to go to work ended up being one of the best things in their life and changed their life.
Oh my God.
Yeah.
I mean, Chuck Grassley is 92 years old. I would almost, I bet you in his head, he was thinking of segregation and Jim Crow as like, and then he's like, well, what else can I come up with that's a little more recent? But
yep. And he's like spouting the old talking points, right? Having a job gives people purpose and dignity. You guessed it, it's central to having a happy life.
So and nobody's happier than Chuck Grassley.
Like I said, he has had a job pretty consistently. I mean, he was 81 was when he went into the Senate. I think it's like 75, maybe it was in the 70s when he got elected to the rep. So he's been in federal office for approximately
longer than we've been alive. Yes.
1 million. Yeah, longer than we've been alive.
And we're not spring chickens.
We're kind of old now. Yeah. We're kind of old, but Chuck Grassley, he's real old.
Truly old, yes.
So he has this kind of crazy thought, and I am just going to. It's this thing. This having a job gives people purpose and dignity.
Right.
It's central to having a happy life, which I mean, I thought was kind of just like standard bootstrap stuff, but actually, he is somehow citing research. He says. The interim final rule takes note of research that finds obtaining and maintaining stable employment is associated with improved physical and mental health outcomes and greater overall well-being, while unemployment and unstable work are linked to poorer health outcomes. Ben, how would you interpret that phenomenon?
I mean, it couldn't possibly be because health insurance is linked to the workplace, could it? Which is the whole point of Medicaid, is to delink that a little bit for some people. I'm sure there's no other confounders either.
So, I mean,
he's a Medicare for All advocate, is what you're saying.
That's what I'm saying. Yes, he came out on the Senate floor for Medicare for All this week. Thank you, Chuck. We welcome you to the movement. He also, of course, went in and actually described what these work requirements are, and I feel like I should actually mention them. It applies only to, quote, able-bodied adults, ages 19 to 64. So 18-year-olds, you get a break. So basically, to fulfill the requirement, people can get a job for at least 20 hours a week, go to school at least 20 hours a week, volunteer at least 20 hours a week, or receive job trainings for at least 20 hours a week. And Chuck says there's a lot of flexibilities that ought to meet the needs of people who want to keep their Medicaid. In other words, if you're capable, you can't just sit at home watching television.
Yeah, so there's only one problem with the case Chuck Grassley is building here. And I was a little bit surprised he went back to welfare, because multiple states have implemented work requirements for Medicaid already in the past.
Right.
So in the late 2010s, Arkansas, Kentucky, and New Hampshire all tried to implement work requirements for Medicaid, but they were all struck down by the courts. So boo-hoo. But the Arkansas one lasted for 2 years. So we actually have, there's like a body of research that looked at what happened when they implemented it. So let me drop a few tidbits here from research on what happened in Arkansas when they implemented work requirements.
Amazing.
So first of all, 18,000 people lost their Medicaid coverage. However, during that same period, when these work requirements were included, employment for the age groups that were affected actually dropped 3.5% in Arkansas. So it did not increase employment in the state. And they actually talked to the people who were dropped, and they did not gain employment, or they did not lose or gain employment. The only reason that people got kicked off, these 18,000 people, was for administrative reasons, basically. So
churn. It's the churn.
Exactly. Yeah, the vast majority of these people were working, but 1/3 of them had not heard of the work requirement. Half of the people who submitted work requirement information gave the wrong information because it was a confusing process. And so that they were kicked out. And that's basically how it happens. It has nothing to do with, it doesn't create work, it doesn't move people into work. And people who are working lose their Medicaid coverage just because you're adding a layer of administrative complexity that is just too much for people's lives who already have too much in their lives. Yeah. And the research also found that these people who were kicked off did not switch to other types of health insurance. They didn't, for example, get workplace-based health insurance.
What?
So they all basically just became uninsured and really, really struggled to pay for healthcare access. So this whole narrative of like work is great for you, which we can and should disagree with, but even if it's all true, even if that's all true, it's not, this provision is not going to move anyone into work is the problem. And it's going to kick out people who are working already. So
I mean, that actually, I mean, Obviously, that's true, says Jillian. You're a fool, says Chuck Grassley. But yeah, I mean, right. We know this from the states that have implemented Medicaid work requirements. We also know this, by the way, from his shining example of the welfare laws, right?
Right.
Like,
Yeah.
we found out that over the long term, right, that even though the numbers of people who were covered by welfare declined, right, that they declined more sharply than poverty declined, right? So
Right.
in actuality, right, this actually helped to deepen poverty. And like you said, right, like in the healthcare system, we see the same thing. It exacerbates inequalities that already exist. It replicates the shittiness of our entire like workforce system as well, right? But who gets jobs? That's who gets jobs.
Right. Yeah.
Largely people who are people of privilege in some way, right? So
yeah. One additional wrinkle here is that as best I understand, this is only applying to people who are getting Medicaid through the Affordable Care Act Medicaid expansion.
That is correct.
Right?
Yes.
Yeah. So of course, all of the right-wing states that have not expanded Medicaid aren't affected at all. I'm sure that goes over well with it. Has Arkansas expanded Medicaid? I almost have a feeling this won't impact Chuck Grassley's district whatsoever. I actually can't remember whether they've expanded or not. A lot of conservative states have over time given him Iowa. Sorry, yeah,
Iowa, Arkansas.
I had Arkansas in the brain because they were the pilot project for work requirements, but
yeah, they were also the ones who've been chomping at the bit with all of the recent changes, right? They are looking to implement their work requirements earlier than required. Yeah. They're also the folks who were really excited about Medicaid re-verification a couple of years back, right? When people, after the pandemic, they ended the state of emergency, and then Medicaid had to re-verify the eligibility of millions of people, and a lot of people got turned off. Arkansas, again, chomping at the bit, so excited. Right, they couldn't get enough, and part of the issue here is that, like, we're talking about like the complexity of the paperwork and stuff like that. There's like a technological aspect to this that's also wild, right? And I think we talked about this before, but like they literally don't have Medicaid application websites that can, like, where people can upload the right kind of identification or the right kind of verification documents for their work, and all of this stuff. So we're setting a lot of people up for failure. And
my memory from when I was a little bit more connected with Massachusetts healthcare stuff was that, for example, Medicaid in Massachusetts, which is called Mass Health, they would not send mail prescription drugs to your house directly, like not through a pharmacy, because there's so much address changes for Medicaid enrollees. And address changes itself is just a massive source of churning. People get kicked out because enrollment forms get sent to their old address and it doesn't reach them, and they don't know that they're being kicked out of Medicaid. So this is going to be, we're just going to see this all repeated again with the work requirements. It's going to be work requirement letters will go to an old address that you don't live at anymore. You won't even know that you're required to jump through these hoops. And then you're going to try and get care somewhere and find out that you're unexpectedly uninsured. So,
yeah, that does seem like what's going to happen. No notes.
Uplifting commentary.
I mean, so like kind of the second biggest story this week has also been about Medicaid work requirements.
Okay, all right.
And that specifically is about who is eligible to be exempted from them, right?
Okay.
So, for example, the elderly, pregnant women, which is still defined as a disability in this country, I think. So pregnant women, people who are the primary caregiver for children under the age of 14, and a number of other folks should be exempt from this law, right? But the problem is, you got to prove it.
Right.
This is the added layer of complexity. So this actually kind of surprised some states because I guess, so a lot of this revolves around the idea of medical frailty, Ben. This is a term that I was not familiar with, and I was sure you would be.
This sounds to me like a term out of the 1920s that just got stuck in statutory language. I mean, having said that, I do feel like a medical frailty case in many months of the year.
Well, yes. Actually, it's funny because the new Trump regulations might actually prevent you from being considered a medical frailty case. So I guess I had to look this all up, right? So the Cleveland Clinic, apparently medical frailty is actually a standard term generally used to talk about folks with older folks. So basically the classical definition, right, which comes from the Cleveland Clinic here, is frailty is a medical term for when your body can't handle or recover from injuries or illnesses. Now, by that definition, Ben, you and I are frail as fuck.
And those pregnant women should work.
Yeah, those pregnant women should work. Get back to work, pregnant women. So this idea of medical frailty, right, used to be really just about like, having a chronic illness, having a situation where your body is not able to actually recover, right? So it's kind of a, again, you can see how this applies to a lot of older folks, right? And folks with different kinds of chronic conditions. So the new Medicaid restrictions, though, sort of go further than that. I know you're excited. So basically what they said is that someone's condition must significantly impair their ability to work, volunteer, or attend school at the rates required in the law for them to be granted exemption.
Okay. Do tuition costs count as an impairment to attending school for 20 hours?
Yeah, I'm definitely suffering from not having tuition money. The chronic state of not having money. I mean, really, that's
a disability.
the chronic state of not having money is really what they're really attacking in this law. Right. So basically this is going to require people to do an additional layer. They're going to have to, either they will have to submit reams of paperwork about how they're trying to look for a job, or how they're volunteering or something like that. Or they are going to have to document the fact that they are medically frail and unable to work. So basically, these rules are going to make it, according to Kaiser Family Foundation, the good Kaiser, as opposed to Kaiser Permanente, the bad Kaiser. The rules make it more difficult for states to determine who should be exempt from the requirements, including by stipulating that having a serious condition such as HIV or cancer does not automatically excuse an enrollee from having to engage in 80 hours per month of paid work, volunteering, or school attendance.
They wrote that on paper?
That's... Yeah. 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 So, I mean, I don't know. It feels very old fashioned to me. Like you said, like medical frailty sounds like a term from the 20s. It's like old timey, like, people riding those bikes with the one big wheel and then being like, I'm going to deal with medical frailty. I don't know. But the whole thing just feels so weirdly like throwback, early 20th century, late 19th century, kind of Dickensian Upton Sinclair shit, It's like, it doesn't matter whether you have...
punishing the poor, basically, is the
it's wild. And the medical frailty thing just like kind of really, I feel like it really like twists the knife, right? Because like, I mean, it's not enough for you to have HIV or to have cancer, right? It's not enough, right? You have to prove that you are sick to the point where you cannot work, right? reinforcing this classical idea that you only deserve to be healthy in this country if you are able-bodied and if you're contributing to our vast capitalist empire.
And just think for a moment about what paperwork you would have to somehow produce to prove that you not only have a very serious condition, but that it is impacting you enough at the current moment that you need to qualify for this provision. I mean, if you need a doctor's note, you literally have to ask your doctor to like write out a letter for you. I mean, you can see how people are going to get churned out just by the administrative burden alone, even for people who definitely should and do qualify for the exemptions. And I feel like I have to say this almost every podcast, but I want to remind people that unemployment is a intentional structural feature of capitalism in America. And we have a Federal Reserve that literally will change interest rates if unemployment gets too low. So they do not want everyone to work. They want a decent percentage of the population to be out of work. And then to punish that percentage by saying, you lazy bums, why aren't you working? It's hypocritical, and it obviously makes no sense, and you can't have both thoughts in your brain at the same time. You can't say we want structural unemployment and we think everyone who doesn't have a job is lazy and should be working. So,
Yep. It is an inherent contradiction. You're so right. And yet it is one of those inherent contradictions that Americans really live with in an unexamined way.
It's true. Yes.
So yeah, I mean, work is good for you, Ben. Just remember, work is good for your health.
It sounds so good when Chuck Grassley says it. It was the other stuff that once we started reading the text, that was the problem.
I mean, so all you need is a nice folksy voice on it, and then human carnage sounds fine. Great. I just wanted to, yeah. So, by the way, public comment on that rule is extended until July, and folks can go to the federal government website in order to make comment. And like I said, I'll put that link in the show notes because you should make your views known. Also, one last thing from that I thought was pretty funny is that he took a little dig at us, Ben.
Us meaning the Medicare for All podcast?
Yeah, specifically, he is calling us out. God, that would be amazing. Oh man, that would really boost fundraising. No. So he took a little stab at the nonprofit people. It's just a little side shade, a little side eye. But he said, for those people that have to work, go to school, or work for a nonprofit, or have a real job, these work requirements can lead to improved health outcomes.
Wow. Does he think that he does not work for a nonprofit?
Mind blown.
Mm-hmm. Who are these people going to volunteer with?
Yes, exactly. Yeah. So
perhaps Healthcare Now could set up a national volunteer program for affected individuals to work 20 hours a week to repeal the Medicaid work requirement program.
Wait, hold up. Okay,
organizing.
More on that later. Ben and I are just going to brainstorm about some things we can do with this right now. That is a really great idea. And if folks want to work on that, you let me know, and we will get to work on that together. Exactly. Sorry, I'm a little bit choked up today. It's because of all the great news. So here's some more news, Ben. And then we're gonna get to that interview. But I did want to just give a shout out to the fact that the Kaiser Family Foundation also did a really some good numbers on how many people have been affected by the Affordable Care Act subsidies not being extended, right? And that is, of course, for those who are listening, that's the reason why your premiums are like double what they were. So basically, Okay, so this not extending the subsidies brought marketplace enrollment down. It could fall to around 17.5 million in 2026 and possibly as low as 16.5 million, down from 22.3 million in
Oh, shit.
2025.
That's a lot.
Yeah. So we start out in 2025 with 22.3 million. By end of 2026, which is this year of our Lord, we'll get to 17.5 million, and it could be as low as 16.5 million. And I would like to point out that these millions that we're talking about are people.
I know the first thought that came to mind is, I know I'm not targeting the right villain here. This is not the right group to blame, perhaps.
Okay.
But my first thought was, aren't Democrats glad they didn't do Medicare for all and instead did the Affordable Care Act expansions and subsidies, all of which have been just obliterated and chipped away at. If we had passed Medicare for all back during Obama's tenure, they would not be able to repeal it. I mean, look at Medicare. I mean, it's an entitlement program that everyone benefits from, kind of the rich and the poor, and you build in these huge constituencies who will not tolerate it being attacked or dismantled in the way that these subsidies are being dismantled. So anyway, my first thought probably shouldn't be, wow, the Democrats suck, but that was my first thought anyway. Yeah. Apologies.
No, that's fine. I think it's fine to be bitter on the left if you've been giving the correct answer for the past 50 years, and the Democrats refuse to hear it, and then they go ahead and they do their bullshit half measures, and then we end up with nothing, right? I mean, I was talking to Rose Roach she's the director of the labor campaign for single payer. We were on an organizing call the other day, and she said, she's talking about how this is just, crushing. Excuse me, I'm so sorry. Excuse me. Ben, you take over. Hold on.
I'm going to try and finish your sentence. I'm guessing crushing organized labor and the cost of healthcare, or no? Maybe she went a different direction on that.
Yeah, no, that was it.
Okay.
And then, So I don't remember why I was going to talk about that, but I do remember what I was going to say next, which is that it's because of this bullshit, right? Where Democrats negotiate themselves down from the very beginning, that this right now, Ben, is such a crucial moment for the Medicare for All movement.
Bargaining against yourself, they call it, I think.
Yes. Bargaining against yourself before you even get to the table.
Could we end this podcast with some good news? Do you have any good news for us, please?
Actually, that leads me into the good news. That was a segue.
Oh, thank God. Bring it. I'm ready. I'm so ready.
Segue. So, as I was saying, this is why, Democrats panic, right? The moment when we're strongest is the moment that moderate and corporate politicians are going to panic, right? So that is why, along with the National Coalition for Medicare for All, which is led by NNU, that's the National Nurses United, Public Citizen, People's Action, Physicians for a National Health Program, Labor Campaign for Single Payer, the UE, and a million other organizations that are all going to be offended that I left them out. But we came together and we decided to write a letter, a little preemptive letter that basically says, don't wimp out yet. And don't wimp out ever. So basically, this is we drafted this letter for organizations to sign on basically saying that we are not going to settle for less, right? Pointing out that Medicare for All is tremendously popular and that we need an agenda that working class people can actually rally behind. And so it's pretty great. And basically, I'll read a quote from it. We may face a once-in-a-generation opportunity to legislate on healthcare in 2029. We need to rally behind the boldest possible reform, Medicare for All, that brings together the broadest possible movement, not overly complex, incremental measures that prop up the same system we're seeing fail under the weight of attacks by Trump and Republicans. Again, call back to what you were saying about we are so excited because we got 335 plus organizations to sign on to this.
Awesome. Amazing.
Those organizations include some pretty heavy hitters too. We've got national base building groups like Move On, Indivisible, the Women's March. We've got our standard, national progressive organizations like People's Action, Progressive Democrats of America. And this goes all the way down to our state campaigns, like the Campaign for New York Health, or Mass Care in Massachusetts, or CalCare in California, or any of the other ones. And it all goes all the way down to indivisible chapters in random cities and towns. Right. This letter represents 335 organizations, and that's millions of Americans who are calling for Medicare for All. And that is pretty fucking good news.
Yes. Yeah, this is the shittiest of times right now, with this Republican majority, House, Senate, and Trump on top. But now is the time to start holding the Democrats accountable for the next phase. So yeah, that's really, really important work, I think. And that's kind of the right orientation. I mean, we have to do some defensive work trying to shoot down all this horrible shit that they're trying to squeeze in before they lose control of almost everything, probably. Yeah. But yeah, I think it's definitely time for the pivot to pushing for the positive stuff that we really need on the other end. So
that's what gets people motivated. And I think, people are just really fed up, and that is itself a motivating factor. Just the feeling of desperation, and we can't take it anymore. So, this is, I think, really good news. It's a really broad base of organizations. I would suggest that folks check it out. You can find links to the letter and also to some coverage of the letter on our Healthcare Now website. So, Ben, with that, on that happy news, I'd like to transition into my interview with the Campaign for New York Health and their amazing campaign to try to win Medicare for All for New York. Sound good?
Awesome. Sounds good. Fuck the Knicks.
Okay. See you next week.
Bye, everyone.
Hey, everybody. I am very excited because I get to be here today with some good friends from New York. So just for some context, as we're recording this, the New York Knicks might just be poised to make history and win their first NBA championship since 1973. Go Knicks. But we are here today to actually talk about a potential win that could be even bigger for New York than the Knicks taking it all. I know. Is it possible? Yes, it is. Because what would be even bigger than the Knicks winning the championship is the passage of the New York Health Act. The New York Health Act, which is currently working its way through the New York State legislature, would basically guarantee high quality, comprehensive health care to every single New Yorker. And it turns out, based on a recent report they've done, that it would also save families, counties, cities, schools, and taxpayers billions of dollars. So I've got here today two of the leaders of the Campaign for New York Health, and they're going to bring us up to speed on the bill and tell us more about how they're working to make universal healthcare a reality in the Empire State. Welcome, ladies. We have here first, we have Melanie Dorigo. She is a healthcare advocate, a community organizer, a mother of three, and also the executive director of the Campaign for New York Health. Hi, Melanie. So good to have you.
Hi, Julian. Thanks so much for having us. We're super excited to be here. And yes, Nixon 5, baby. Nixon 5.
Nixon 5. Nixon 5. We also have Dr. Cheryl Cashin. She is a managing director at Results for Development. And a globally recognized leader in health financing and universal health coverage. She's advised governments across multiple continents and partnered with institutions like the World Bank, the World Health Organization to design and implement these really amazing high-performing healthcare systems. She also serves as faculty for the WHO's Global Advanced Course on Health Financing, which helps to train senior policymakers from around the world. And she is a widely published thought leader. Dr. Cashin is known for translating complex health policy into practical real-world solutions. She has a PhD in economics from the University of Washington, and she brings both global expertise and a strong commitment to advancing universal healthcare to New York. Welcome, Cheryl.
Hi, Jillian. It's wonderful to be here. And I'm a recent Knicks fan, but you have to jump on the bandwagon.
Oh, I totally understand that. Our listeners will probably be familiar with me talking a lot about my home in Texas. But as I was telling you beforehand, I may live in Texas now, but I'm Bridge and Tunnel Jersey girl for life. And nobody loves the Knicks as much as a Jersey girl, right? Who desperately wants to be a New Yorker. But that's another story. Ladies, it is so good to have you here. I am super excited. You have this amazing report out. But before we get to all of that, and before we even get to the New York Health Act, tell us a little bit about yourselves. Tell us about how you got inspired to do this work. I know, Melanie, did you want to kick it off?
Yeah, sure. Why not? Well, thanks again, for having us. We're super excited to be here today to talk about our incredible bill and this amazing white paper that was newly released. Of course, Dr. Cashin is one of the authors, as well as Dr. Esther Quest. So big shout out to them. We're just, I think it's been the secret sauce we've been missing. But how did I get into this work? Well, I have a master's in exercise physiology. I spent my earlier career in working in allied health professions, building, corporate wellness programs, all over the country. And, it was sort of my passion. I loved my job. I loved being able to look and say, how do we adjust this data? I'm looking at these health outcomes. How do we make people healthier? And it was really my passion. Never did I think I would wind up somehow in the political realm. But, life is funny that way. Sometimes you get a villainous character on the scene that threatens, our way of life. And I'm a big believer that government should work for the people, right? That's their job, right? Life, liberty, the pursuit of happiness. They should be working for us every day. They should be trying to figure out solutions to invest in the people, invest and make our lives better. And what I saw about, during that first primary, which got over 10 years ago now, here was this villainous character on the scene, who to me was just such a bully. And I'm like, oh, I've seen this before, right? I've seen this script. And I found myself getting really angry. During the primary, I was pregnant with my third child. And I had two little girls. And, I remember I don't remember feeling that angry before in my life. And I'm like, how is he garnering so much support on these really hateful, harmful policies? And I think it just really forced my head out of the sand. I think for parents, especially with young kids, you're up to your eyeballs in diapers for years and years. And then all of a sudden it was like I got whacked in the face and I'm like, what is happening? And then, I kind of took it personally and I'm like, all right, I haven't been doing enough. I bet there's a lot of people out there that haven't been doing enough. So that's the only way I can think of to fight back, right? I'm not good at sort of sitting with sitting right? That's just not me. Like I only feel good in motion. So I started volunteering. I started volunteering everywhere I could to make a difference, to make my community better, to make the lives of my kids better, which led me into politics. I started managing campaigns, and then I ended up running for office myself. I ran for Congress in New York City 3 twice. Unfortunately, was not the outcome that I had been seeking, to win the election did not come to fruition. However, another pretty incredible outcome did. I ran as a Medicare for All candidate. And even though, the political aficionados in my district, no way you can win. What are you doing? This is crazy. This is suicide. Which I thought was such an insane thing. That I think was when I really started to realize, like, oh, we're not on the same team. Oh my God, we're not on the same team. I'm not going to run for office on something I don't believe in. Why would anybody do that? Right. So naive of me. And I ran as, an unabashed Medicare for All candidate, and we changed hearts and minds all over the district. Right. So much so that after those runs, Medicare for All is polls overwhelmingly high in that district now. And so sometimes we don't always get the change that we, initially want, but oh my God, what a great secondary prize. Right. And so we can, and I'll tell you how did I end up here leading the campaign for New York Health, which is we lead the statewide coalition to pass and implement our single payer bill, the New York Health Act. It's actually a bittersweet, but it's sort of full circle moment because Cheryl's here. One of our most valiant New York Health Act advocates in Long Island, Steve Cicchini, he was just the best in every way, really pushed for the New York Health Act, would talk to everybody anywhere about it at any time. And he was really our resident expert on the bill. I had just lost my second primary. I had lost my faith in democracy. To be honest, I was in a
that'll do it. Yeah.
We can't organize people on behalf of people. How the hell do we ever, overcome the corruption? And I was in a pretty dark place. About two days after I lost the election, I get this little message from Steve, and he says, "Hey, I know you probably don't want to read this. It's probably the last thing you want to think about, but the campaign for New York Health is hiring an executive director." And he says, "I cannot think of a better person to lead this organization than you, and I know you can make a huge difference." And honestly, I was so gutted at the time. And he looks at it, and we get I think it made us cry because we were so emotional over the race. And he's like, "Well, it came from Steve. You just have to apply." And I'm like, "I don't even know if I'm in the right headspace." He goes, "Just apply," And I did. And the process took a little bit of time. And unfortunately, Steve passed away before I became executive director. He was battling cancer. So every day that I'm in this job, every day that I do this work, I think about Steve, and I think sometimes I look up, and I'm not a religious person, but I look up and I'm like, "We're doing it, Steve. We're doing it."
Yeah.
I'm excited for us to talk about this white paper because Steve really pioneered this work. So it's a little bit of a full circle moment.
I really appreciate you saying that. And I think it's so important, especially in the health justice movement, where so many of the folks who are fighting with us, we will lose them right before we get to the finish line. That's just the reality. And I just think it's always important to be speaking their names out loud and to be carrying them with us as we move forward. So I really, really appreciate that. That's beautiful. Steve, what's Steve's last name again?
Well, I mean, there's I think there's some disagreement, Cheryl, right, in terms of how to pronounce it. I was introduced to him as Steve Cicchini, but I don't know, Cheryl, right? There's a few different
I call him Steve Cicchini too.
Yeah.
Great. Yeah, we're going to go with that. Steve Cicchini, rest in power. Thank you for everything you did to bring Melanie and Cheryl here to us today. Thank you so much. And Cheryl, you have a very, very fancy pedigree. I don't know how else to say it. Tell us about how you got involved in this work too.
Well, I just have to pull myself together a little bit first. Melanie, thank you for bringing up Steve, who brought us together, and I couldn't be more grateful to him for doing that. So my background goes back, I would say the start of this journey started in the mid-1990s when I found myself in the former Soviet Union after it had broken up. I was in Kazakhstan, and they were rebuilding their health system. I was a PhD student at the time working on health economics, and I got associated with a group who was advising that government on how to rebuild their health system. And they were advising them on how to build a single payer system. And most of these people were exiles from the Clinton health plan. They had all worked in various positions trying to get that bill passed.
That is
and when it failed, they were
fascinating
so
and totally
right.
makes sense. Yeah,
Very long history, very long arc. They were so disillusioned about the possibility of making things better in the US that they left and went to the former Soviet Union. So they were my mentors, and we worked on the very first single payer system in one of the former Soviet republics in Kazakhstan. When it opened its doors, I was there. They didn't have computers yet. So when I hear that New York can't do this, can't implement this, I don't have a lot of sympathy. They were implementing this without computers in the mid-1990s in the former Soviet Union. So I started working internationally and doing that all over the world. Really passionate about health equity and working in countries where the governments had the will, and working in Africa and Vietnam, Indonesia, where the governments weren't debating, should we provide access to healthcare for everyone? It was, how should we do it?
Yes.
And so joining that movement of trying to generate that evidence and understanding about what works, that became my life's journey. And never did I even think about, people would say, oh, we have problems back home, you should be fixing our healthcare system at home. And I said, good luck. No one seems to want to take that on. And then I came across the New York Health Act. It was at about the same time that Melanie was waking up to these things, that we have to focus on doing what we can to make change in our communities. And I came across a group, the Progressive East End Reformers on the East End of Long Island, who introduced me to this thing called the New York Health Act. And I couldn't believe it. I read it really carefully, and from my, working in other places, found it to be best practice. I couldn't find another bill in the world that was as well written, as thoughtful, and considering every possible unintended consequence, and trying to make sure that everyone could benefit from this, who needs to benefit from it, and the people who need to pay. And so I became so excited about this opportunity, and started to work on public education, having forums, and worked with Steve. We were a little bit of a duo for a while during COVID, and we did at least 15 or 20 forums together. I think I was the straight man and he was the color commentator. And then
researcher usually is, yeah.
Right. I made the graphs, and he was the one who convinced the people. And then, there was a little bit after Steve passed away. I have to say, I stepped away for a bit. Had a really hard time, and I lost a little bit of hope. And then when Melanie took over and injected this huge amount of energy into the campaign, I just came back, and I came to meeting after meeting, like, how can I help? How can I help? I couldn't figure out the right way, because I'm not the activist, I'm not the organizer. But then we found this analytical inroad together with Judy, who had been doing the work on looking at budgets, and we came together and we revitalized the work that she had done with Steve, that I did a little bit with Steve, making the graphs, and we, ended up with this white paper.
That is amazing. And it all came out of those heady post-Soviet days. Oddly enough, I was in Eastern Europe then too. And so I am very familiar with like the neoliberal expats who set up shop there. So that is really fascinating. And then of course it all comes back to Steve. Love it. Let's talk a little bit, just for folks who maybe haven't been compulsively looking at your website. By the way, that's in the show notes. You should definitely check it out if you haven't yet. Tell us about, like, what is the New York Health Act, just like your elevator speech version, and where is it right now, like in the legislature?
Yeah, sure. So the New York Health Act is, as I mentioned earlier, it's our single payer bill in New York State. So what that means is upgraded and comprehensive healthcare for every single New York resident and full-time worker in the state. That's all medical, dental, vision, hearing, prescription drugs, and long-term care, making it the most comprehensive plan out of any other plan in the country. There are no premiums, no copays, no deductibles. It's paid for by a combination of federal money and a graduated tax. Really, it is, for a long time, we pitched this as the moral answer. And of course it is, right? And sadly, we learned that that's not enough for everyone. But we also know that it is the fiscal answer as well. So we're pumped to be here to talk to you more about this bill. Where is it today? Look, it's been around for a long time. And so I think we've had hills and valleys, peaks and valleys. We are, I believe, poised to move this bill next session. We are injecting an incredible amount of energy. We've launched our campaign for next year. We plan to build throughout the summer, really diversify and fortify our coalition and bring on new co-sponsors and deepen relationships with existing co-sponsors. So we're really excited. This is the answer that checks a ton of boxes to the health that the federal government has hoisted on us with these federal cuts. But, if we're really honest, healthcare wasn't great for any of us before these cuts came into effect, right?
Oh, yeah.
So we sit, on the precipice of a state that by no means are we alone in New York. But these federal healthcare cuts for us mean, July 1, we have about 470,000 individuals that are losing healthcare just like that.
Yeah.
Because they're losing their essential plan access. In January, that's when the Medicaid cuts, or the Medicaid changes, right? They will start to kick in, and we expect to lose about, coverage for about another 1 million more New Yorkers. This means that everyone's premiums are going up. This is going to force hospital closures. It's going to be a nightmare. Everybody's going to feel this. Even if you are well-to-do and well-off, or you've got good insurance, whatever the heck that means these days, that's going to mean nothing if your hospital closes, or the county over hospital closes, and those people are shoveling into where you get care. So we're really converging on several crises, and we're pumped because for all of us organizers, like for years, it's just been like we've just been getting kicked in the teeth, right, over and over and over.
Yeah.
So I would just like to say that it is a real joy, it is a real pleasure, and it is a real privilege to be working on this bill and to extend hope and a real solution that would do so much good for so many people. So we're taking that message all around the state, and we cannot wait to move this bill. We cannot wait to deliver, healthcare for every single New Yorker. And, if any elected officials are listening, I'm saying it now. You pass this bill, you can run for president. That is how transparent. And you'll win 100%. I'm saying it now. We'll roll the tape back.
Yes.
That's what happens.
Yeah, no, absolutely. Oh my gosh, this is such an exciting moment. And, it's an exciting moment for Medicare for All folks all over the country. Y'all are so poised right now to do something really great. And it feels like New York is in a moment right now when folks are starting to see things a little differently. And I feel like this report is going to be a big part of that. I was so impressed with this report. The report is called, New York Health equals New York Wealth, right? And we'll include the link to that in the show notes as well. But I mean, really, you have some big numbers out there for the kind of cost savings. And I guess what's interesting to me is that we generally think about cost savings in terms of our personal budgets, right? Am I going to pay less in my premiums? Yes, the New York Health Act would do that, right? That's great. But also just the amount of money that it can save for cities, towns, whole school systems, just so much. So why don't you just walk us through what are some of the most surprising numbers there? What do you think is, what sort of theory is sort of emerging out of what you learned here? Yeah.
Sarah, why don't you take that one?
Yeah, well, maybe I'll start with why we looked at this. And it's because one of the worst parts of our healthcare system that no other country does is puts all the burden of health insurance on employers.
Mm-hmm. Yeah.
And that means that our coverage is tied to our employer, right? So if we change jobs, we lose it. That nowhere else in the world do you see that approach. And we often forget that our towns and schools and counties are employers too. And so we were thinking they also have this burden. And so we wanted to look and see, we know that our taxes are going up all the time. How much does health insurance have to do with that? That was kind of our hypothesis going in. And little did we know it has a lot to do with it. And a lot. And we found, just a headline is that counties are spending 90 to 95% more than they need to on health insurance. If you swap out what they're paying now in private coverage for this, the way that the New York Health Act is funded through a progressive payroll tax, that expenditure drops 90 to 95%.
Okay, so wait, just let me clarify here. So a lot of us say things like, or when I say us, I mean me. People like me say things like 90 to 95%, and we mean that as a general sense of the thing, but you're the researcher. So this is literally 90 to 95% they're overpaying on their healthcare.
Yes. And that's like a savings in the county where I live, Suffolk County, of $745 million. So that's the savings, right? So that means we're overpaying now in our taxes, $745 million in Suffolk County. And so this is an extraordinary amount. And within that is what the county is paying for their employee health insurance and their retirees. They also have that. Plus, they have to pay their share of Medicaid. And that would be absorbed under the New York Health Act into the pool. So that also goes away. That's why the counties have a bit higher savings. The towns and school districts, it's 80 to 85%. It's still extraordinary. And there are a few reasons why this number is so huge. One is that, first of all, they have fairly generous coverage, better than some of us on by our employers, and that's great. And we want them to have excellent coverage. We want them to have tax-funded coverage, but it's very expensive in the current situation. And they're covering their employees, dependents, and retirees, so that sometimes doubles their bill. And on the flip side, their payroll is much smaller than average private employers. That we looked at the salary structures. Most of them are making under $200,000. You have to make $300,000 for your tax payment to roughly equal the insurance plan for a family. Right. So it's just like you can't even what the burden is now on these public employers is extraordinary. And then the way that the bill would be financed, it's more progressive. It would have a broader base so that these costs would be distributed across payroll, but also other income. So it's just a much fairer, saner way to finance. But then, so just one more thing, we got that immediate number for Suffolk County, and we thought, Suffolk County is an outlier. It's a rich county, it's big. And so we started looking at other counties, and we eventually looked at a county in every single economic region of New York, all 10 regions, the same results. It doesn't matter if you're urban, rural, big or small, it's proportionally the same. 90 to 95% for counties, 80 to 85% savings for towns and schools.
That's kind of wild, actually. I mean, because, one of the things that I always think about when I think about New York is just how huge and diverse it is, right? Like, I think a lot of people, when they think about New York, they think about New York City, which is fine. It's a great representative of the state. But it's a huge state with huge geographical and economic diversity, people who are farmers, people who are miners, people who are, it's wild, right? The number of, so it really is consistent, though, across New York that folks are paying more. And it's really just because of the way that the system is set up.
And I call it a hidden tax. It's a hidden tax because no one realizes that we're paying this. And I laugh because a lot of people argue against the New York Health Act. Oh, we don't want tax-funded healthcare. That's socialism. But they are paying for tax-funded healthcare, just not their own.
Yes. When people have that argument, I'm always like, sweetheart, what do you think you're paying for now? You're paying for me to go to the emergency room because I can't get preventative care, which would have been cheaper for you. So maybe ante up for the preventative care. Absolutely. This is just like fantastic. Like kind of receiving the news. I imagine you've been talking about this with the media and with a lot of your stakeholders and organizations and unions and stuff. How have folks been receiving that news?
Yeah, we've had, I think, a tremendous response. It's been really fun, to be honest. Sometimes we don't always have new information to take to stakeholders. And so to have something of this magnitude, to be able to show and link it so directly to legislators, districts, or take this to unions and say, look how this would change your members' lives, right? And frankly, it's already helped us bring in new coalition members, which is really exciting. I feel like we've just launched. I think there's going to be a lot more to come. We've got a lot of good interest, pretty heavy hitters in the media world that would like to profile, this new report. So I think, it's all part of our strategy to keep building momentum throughout the summer and into the fall. I've been, even for the most risk averse, like let's say like legislators, we launched this white paper in Albany. Notoriously difficult during budget season. Folks are like not really down to there's lots of stuff happening. And even our most risk averse, our most purple, districts, they're sitting down with us and they're like, hold on. Like, and we recognize like the data is so compelling that your body almost doesn't want to believe it, right? You're like, how can this be true? And we're so lucky to have someone like Cheryl where she can break it down and say, here's exactly how it's true, and it's wow. And it almost forces their hand, right? It forces their hand to support. And I keep saying, look, right now, Cheryl and Duty have uncovered this incredible piece of information where I think it's giving legislators and even stakeholders, frankly, an opportunity to say, wow, we did not know that about this bill. So if we've historically resisted it, now I can't say no. I have to come on board, right? And I think there is a window of opportunity. When that window shuts, I don't know, New Yorkers, like many other folks around the state, they're sharp, they're keen. It's not going to take that long before New Yorkers start to say, wait, you're not supporting this? Better healthcare, federal cuts, healthcare. This will give me better healthcare, more comprehensive healthcare. I would spend less on healthcare, and you might lower my taxes, keep my schools intact. And you're against this? Why are you wasting my money? Why are you over? And that, that's going to be a conversation that shifts. So, we're working diligently to try to bring everyone in first. We're very much carrot first, and I think that it's, and Cheryl, I would love to hear your thoughts on this, but I've been really pleased with the rollout and the response so far. And I think it's only going to get better.
Yeah.
Well, and I think that and this is also true, I think in my global work, what really moves the needle is when you show a concrete piece of analysis that's based on data. It's their own budgets. This is real. It's not modeling. It's not, that's all important. It has its place, but you can't argue with this. This is an actual budget. These are actual, so then the conversation becomes different. And I think this falls into the it's too good to be true category. And I think that's a little bit when we get that first resistance, but over and over again, everything we find out about this bill, it sounds too good to be true because our current system is so bad. And like the positive thing is these are potential savings, but the negative side of this is the waste now. This is the overpayment now. The status quo is a problem. And I think that this is just showing another angle of which it's a problem.
Yeah, no, absolutely. One of our good friends of the show, Alex Lawson from Social Security Works, who is, constantly around the country trolling all of the evil healthcare assholes. And he always, we were talking a couple of weeks back about the war in Iraq. And I was like, they say that we don't have money for healthcare, but we have money for the war in Iran. Sorry, Iran. I'm from the 90s. And he was like, yeah, well, they're making money off the war in Iran. And also Medicare for all could be a moneymaker too. So I think that I think it's kind of exciting, at least for an old socialist like me, to be able to make the capitalist argument for a change, yes, guys, Medicare for all, fucking cash grab for New Yorkers. Let's go. The people of New York, get your bag, I love it. That's fantastic.
The other thing that Melanie, you've been saying is that it's also a chance to make government work better. Like in this moment where government's being dismantled and there's just such an effort to make government not work and have people lose trust and faith, this could make government work at the state level. Healthcare can work, but it also will make our local governments work better. And they'll have the resources to actually invest and to do things and, fix things. And our schools won't be fighting every single year to raise property taxes and have the community, it's just a chance to make a lot of things work better, including healthcare, but other things as well.
No, it's just really great to see how healthcare is sort of just one of those little Jenga pieces, right? But once you take out the for-profit insurance, all of a sudden this whole architecture of oppression sort of comes tumbling down,
Yeah.
It's awesome. So, we were talking a little bit about kind of your special situation in New York. I was talking about geographic diversity. Of course, you've also got obviously the most famous city in the world, right, is right in the middle of New York. Well, I guess not in the middle, more towards the bottom, but New York is every state is unique, right, in its own way. New York is unique in like pretty much every way, right? So it's got to, for an organizing campaign, that's got to raise a lot of really cool pluses that other people don't have, and also some cons that maybe other folks don't have to deal with. So I wondered if y'all could talk a little bit about, yeah, like what were some of the like, you know, special benefits or special obstacles of doing this organizing in New York?
Wow, that's a good question. Yeah, I mean, like you said, New York is extremely diverse and it's very large. And, you know, it's the sort of epicenter of everything. So I think in terms of barrier, you know, all of our sort of people-centered movements are underfunded, right? And I feel like I can confidently say that across the board. So a lot of times that keeps us siloed, right? And we're just, everyone's just working to try to keep the lights on and try to advance and as best they can. And I think that can be a barrier. With more funding comes more resources, and we could all better, you know, communicate. And I think I've always been a big advocate of getting all the bigs in a room and being like, look, a lot of this work is, almost all of this work is interrelated. We need a full court press together because we need to harness our strength. I'm a little corny. I'm a big believer in strength in numbers, right? That's how we do this.
Yes.
So, you know, I think that can sometimes be a barrier, especially because there are natural partners that love our bill and want to see our bill advance, but, you know, they've got 15 other things on their plate and they're like, oh, but it's been around for so long. Could it really happen? You know, this, that, and the other. So I think that can be a barrier. A positive, you know, we have tons of organizations that work in coalition with us. You know, that's what we do. We run the coalition. But I'm really, really proud of our hubs that we have started. We've got geographic hubs all around the state. And, you know, to borrow a quote from my captain of the Knicks, you know, the magic is in the work, right? The magic is in the work. And we find a way, right? And we've had amazing individuals step up around the state to say, yes, I want to lead my regional hub. Some of them know nothing about organizing. They're like, I just love this bill. And I love that, right? Because then that means like we get to teach them and they get to give us feedback, and then they go off and then they teach others and they mentor other folks. And we're also very fortunate that, you know, this bill's been around for some time. It's been pressure tested. It's been, I think it's, you know, better than ever. It's been tweaked over the years. It's such a solid, wonderful piece of legislation. We're lucky that we have activists that have been at this work for a long time, so they can really step in and help mentor, you know, new advocates. So I think, you know, I'm a big believer, again, super corny, apologies. If you build it, they will come, right? And we have built out
all the sports analogies.
I'm sorry, I'm like still like in Knicks era. So
yeah, absolutely. Yeah.
So that's where my mind is at right now.
Oh, yeah.
And I'm totally drawing every parallel to this sort of Knicks rise to like our movement's rise.
Yes.
You know, since 1973, we don't have a championship. You want to talk about a drought? You want to talk about a long time? You want to talk about believing in something, making impossible possible? Well, the Knicks are doing it now, and the Campaign for New York Health is going to do it next year when we pass this bill. So yeah, it's just an exciting time. I think New Yorkers are great. I've always said healthcare advocates are the most passionate, resilient people I've ever met. They're such a gift. You know, and that's, you know, we're so fortunate to have these folks that come to us and are ready to like boots on the ground, ready to do what needs to be done. You know, and it is, sometimes it's a slog because it's day in, it's day out, it's relentless. But we're so lucky to have that army. And as I said, the magic is in the work, and we can't wait to see it pay off.
Do you want to just shout out some of the places where you've got hubs? Because it really is impressive. Like you've got so much going on all over the state.
No, gosh, I don't want to leave anybody out. Oh my God, we've got our, as I said, like our coalition, organizational coalitions. A lot of them are in New York City. So a lot of our, you know, advocates kind of sort of funnel into their organizational membership, right? So we sort of have that. That's a little bit different because, you know, we're strategizing together. But in terms of our hubs, we've got Long Island, we've got Hudson Valley, we've got, we do have a separate one in the Bronx. We have one in Westchester. We have Central New York. We have Western New York. Cheryl, who am I missing? Oswego County, Delaware County. I feel like I'm missing a couple, and I'm so sorry. I was.
Honestly, it's a good problem to have when there are so many of them that you can barely get them all in a sentence.
Yeah, I mean, it's really exciting, and it's as I said, it's a joy to work with folks that want to fight for a better world. We may be an underfunded movement, but we have an abundance of riches of passionate individuals who are ready to do the work.
I think it's also, I mean, to draw another cheesy Knicks comparison, they came out of a bad season, right? They came into this season knowing that they wanted to do something different, right? And they recommitted themselves to doing something different. So it was the same goal as always, right? But they came in with a new energy, right? And I think that that's really cool and really one of the things New Yorkers are best at. You know what I mean?
I think, Melanie, what you do and what we're trying to do is to paint a vision that this is not a dream. This is real. It's practical. It can happen. We can visualize it. Mm-hmm. And it's not a huge leap. We have a lot of the pieces already in place in New York. We have good infrastructure in terms of, the agency managing Medicaid and the public employee health insurance. It's there. This is not a huge leap. So we're trying to paint that picture, that yes, it sounds too good to be true. It is real. The math has been done. It's been analyzed more than any bill I've ever seen in the world. But now let's think practically. We can visualize what this will look like. It's not a huge leap. And I think painting that picture is also getting people to just demystify this. It's possible. They do it all over the world. And we can do it. We have more resources. We can do it.
Yeah, absolutely. No, I think you're absolutely right. It's a beautiful dream, right? But that dream is so close. We can touch it. We can smell it. Like I can smell not having to pay premiums. Yeah.
It's a dream. And I think, we have to do some education around that. I think as a whole country, we have to do some education around that. There's been this very annoying narrative that like this is such a wild radical idea, and it's like no, quite the opposite. In fact, quite the opposite. It is so radical that we are the only country that does not it does not guarantee healthcare as a right. So yeah, I feel like we're close. I'm excited. I think that and I think like tying it into sort of the broader Medicare for all movement, right? Unfortunately, I don't think that's going to happen at our federal level for quite some time.
Well, that's real concern.
New York passing this bill, other states popcorn passing it, and then all of a sudden we've got a whole different dynamic to work with on a national level to pass the bill. So one of us has to pop, I think New York is ready.
Absolutely. That's awesome. I love that. I love that y'all are in a race with California and Oregon and Washington, and we'll see who gets there first. But frankly, we all win, right?
I don't even feel like it's a race. I feel like it's like a tag team. You know what I mean? Or we're like running, holding hands together. Because I don't feel like it's competition at all. I feel like you need an assist. I'm gonna give you all my energy to assist because I know that whether it's California, it's New York, it's Oregon, whoever it is that pops first and does this, it helps everybody.
Absolutely. We know that's how our friends in Canada did it, right? It's a great plan for us, and here at Healthcare Now, we are agnostic on the question of how we get to Medicare for all, as long as we're fucking moving towards Medicare for all.
As long as we find a way.
Absolutely. Well, that's absolutely wonderful. And just before I let you go, speaking of all over the country, there are going to be people who are going to be listening to this, my neighbors in Texas and, folks in, Idaho and other states that exist. And so if those folks are listening and thinking, God, this sounds amazing, I really wish that I could make this happen in Idaho. What learnings, what stuff have you learned about this that you would give them as their first piece of advice to start out?
Just start, right?
Just start.
You don't have to be perfect, but you have to start, right? If it stays in the mental space, it lives and dies in the mental space, right? Understand that it's a process. A good strategy is a plan, right, to succeed. So you always need a strategy. I always say start with the goal and then work backwards from there. So you understand. I'm not a big believer in just throwing tactics at a wall to see what sticks. I think you should always be as strategic as possible. And then just start and be easy on yourself, right? Because I think a lot of us in this work, we think big, right? We're the believers, the dreamers, right? We want to see big things happen, and we know that it's possible. And a lot of times that requires big plans, right? But if we don't have those resources right away for those big plans, that can sometimes, be at odds with one's. Why would build that into your strategy? We're going to start here. If it means I'm one person and I'm going to go around and do some education on this type of a bill. And when I'm there, I'm going to try to recruit new people. And then when I have this amount of people, then I'm going to teach them how to do communications, and they're going to run communications, and someone else is going to run events, and someone else is, and I think you just have to start and really be methodical about that plan. And then you watch it grow.
That's beautiful. That is beautiful. Yeah.
To add to that, Melanie, I think from the individual level, like everyone can start somewhere with whatever gifts you have, whatever resources you have. For me, with making a spreadsheet, but do whatever you can. And I think we have to start with the facts. There is so much misinformation and like emotional response to socialized medicine. Like we have to bring the facts to the table, and the facts are on our side. And the two sources I always go to are the Kaiser Family Foundation and the Commonwealth Fund. They're always giving updated information on the horrors of our current system with numbers and facts. And so to have the facts on our side and to bring those into the conversations that you might have, in my case, it's on the ferry boat, leaving Shelter Island, or wherever you can, meet people where they are, and just kind of get rid of some of the misinformation person by person.
Absolutely. And I do have to take this opportunity to do a plug. Healthcare Now, we're actually doing a series of summer trainings that's going to be kicking off. It covers everything from healthcare policy to how to organize, and it's open to folks all over the country. You can go to our website, www.healthcare-now.org. And you can sign up for a training there. But our first training is going to be Medicare for All Mythbusters, where we deal with some of those really pernicious myths about our healthcare system, starting with the George W. Bush quote that we have the best healthcare in the world. There's still a lot of people who believe that. We still have to work on it. Anyway, this has really been fantastic. I have loved talking to you guys so much. You're remind me of home. Mid-Atlantic girls got to stick together. Really, really appreciate you all. And best of luck to you and to the campaign.
Thank you so much, Jillian. It's been a joy to be here. Thanks for letting us, share this incredible white paper that we can't wait to, continue to spread the message. I just want to do a quick shout out to our awesome bill sponsors, Senator Rivera and Assemblymember Mullen, and special shout out for the Honorable Dick Gottfried for writing this bill with the New York State Nurses Association all those years ago, who are still very involved. We can't wait. And please visit our website if you would like to read the white paper, nyhcampaign.org, and or get involved.
That is fantastic.
Thank you, Jillian. Thank you for getting this word out.
All right. Excellent. So I want to thank everyone, especially our podcast team, especially our audio editor, Craig Stanton, who is the best. Remember to like, subscribe, comment, and share with your friends. And also, of course, this podcast is a project of the Healthcare Now Education Fund. You can support the pod by going to www.healthcare-now.org and clicking on the donate tab to send us some love and check out those trainings while you're at it. Thank you, everyone. Stay safe and stay dangerous.